Hello again. This is Dr. Greg Alexander with the Pediatric Office of the Future videocast series for 2011. I'm joined today by Pete Eggleston, who is the Chief Marketing Officer for SBR Health. And SBR Health is a new sponsor this year. So first of all, Pete, thanks for your sponsorship. And second of all, thanks for joining me here today.
You're welcome, Greg, and thank you for getting the opportunity to speak with you today.
Oh, it's my pleasure, believe me. And again, my pleasure to have you presenting in the Office of the Future. You are a Boston-based company, and that really fits well with the NCE this year because we are in Boston. I'm just going to kind of turn you loose and let you tell the viewers what they might expect to see at the SBR Health portion of the Office of the Future this year, and what kind of tools or things they can learn about.
Sure, thanks, Greg. So basically what SBR Health is doing is leveraging the latest lightweight, ubiquitous, any device, any network video technologies to create clinical applications that allow clinicians and patients and other caregivers to communicate seamlessly using video. And we're doing that in such a way as to fit seamlessly into the existing clinical IT and clinician workflows. For example, and we're applying this in a lot of different ways, but for example, what we're doing with, say, the Children's Hospital here in Boston is we're looking at several problems. One is how do you reduce readmissions? And so there we're looking at applying better communication methodologies to doing more post-operative follow-up visits more frequently but shorter, how to do better care coordination, and how to do better care transition between the acute and the ambulatory care. In other situations, we're looking to improve access. So, for instance, a patient might be in a location where he or she is unable to get travel to see a clinician. And in the case of some patients who are undergoing acute care, it's often more dangerous or a discomfort to the patient to transport them. So how do you get that access? And then the third thing is how do you get access to a specialist when you need it? For instance, with children's, they have several associated hospitals, and often a patient might show up in an ER at one of these remote hospitals, and they need to consult to see, is this a patient that we should transport, or can they treat them? And it's always better to treat them and not have to transport them. So video often gives you a better capability to assess the patient condition and even assist the ER clinicians at the other end with delivering that good care.
Pete, when you mentioned children's, you're speaking of Children's Hospital Boston?
That's correct.
And you've got some pilot programs going with them or some other institutions, correct?
That's correct. We do have some active pilots going with children's. We're getting ready to launch some pilots, predominantly in what we call post-discharge follow-up. So this would be things like monitoring head traumas or monitoring or doing virtual visits with post-discharge patients for such as urology. And then the third one would be for pulmonary. So we're looking at how do you do pulmonary visits remotely, and as well as how do you create virtual clinics where you can bring the patients in virtually for quick checkups as opposed to having them make the trip into the hospital.
Great. And I understand you also have some waiting room patient education kind of solutions.
That's correct, Greg. So one of the things, if you go to a regular clinic physically, you have a waiting room in which you wait for the doctor. And as we know, doctors often can't control their schedules, so you don't know how long the patient's going to be waiting there. You have the same situation if you're setting up a virtual clinic with video. So what we've done is we developed what we call a virtual waiting room. And there, it's actually a golden moment. You've got the patient or the caregiver's attention, so we can serve up educational content to help educate the patient and the caregiver in terms of disease management, and even prepare them for additional visits back to the hospital or facility if they're actually going to undergo an operation or something. You can teach them about that.
This is great stuff. Near and dear to my geek heart. It's true. Patient engagement and education and physician communication between physicians, and provider and patients. Using technology that can really facilitate that. I love this stuff. So very happy to have you guys joining us this year, Pete, and happy I'll be really looking forward to taking a look at what you have to show. So thanks for joining me here today.
You're welcome. Thanks, Greg. And we look forward to the opportunity to participate in the Pediatric Office of the Future.
Yeah, Greg Alexander, thanks so much.